Well, hello and welcome back everybody to Anatomy 1. This section will cover the upper limb, and in this lesson, we are going to go over the shoulder, the posterior scapular, as well as the axillary regions. This is going to be lesson 3 in your plan. So now in today's lesson, we will go briefly first through the shoulder and the posterior scapular regions, because these regions contains some very important structures and muscles that will be covered more when we go on to the axilla, as well as the contents of the axilla, and as well as the space in the posterior scapular region. And then after that, we will cover the axilla, which is basically the armpit in colloquial terms. But the axilla is more than just the armpit. It is a conduit in order for the different contents to leave the thoracic cavity and enter the arm, if you will. So now some of the very important components, such as the axillary artery, the axillary veins, and as well as the brachial plexus, which is the complex of nerves that we will cover at the end of the axilla when we talk about the contents, are going to be passing through this space in order to get through the upper limb. So now let us go ahead and discover a little bit about the shoulder and the posterior scapular regions. Now, the shoulder, like we have already discussed before, is a joint complex that contains more than just one joint. In fact, it contains 3 joints in total, and those 3 joints are going to be the sternoclavicular joint, which is right here, which is basically the articulation between the medial end of the clavicle right here, as well as the manubrium of the sternum. And then we have the acromioclavicular joint, which is the AC joint, if you will. And this is made up by the articulation between the lateral end of the clavicle right here, as well as the acromion process of the scapula right here. And then finally, we have a very movable joint, one of the most movable joints in the human body that we have already studied previously, which is the glenohumeral joint, which is formed by the head of the humerus right here, articulating with the glenoid fossa of the scapula right here. So now we have already covered the glenohumeral joint in some detail. So now let's just go briefly through the sternoclavicular joints as well as the acromioclavicular joints. All right, so now let's go over the sternoclavicular joint. As we have said before, the sternoclavicular joint is formed by the articulation of the medial end of the clavicle right here and right here, with the manubrium of the sternum, which is this piece of the sternum right here. This joint is not a very movable joint. It has an articular disc in the middle, and it is covered by all those ligaments that makes up the joint capsule right here. And because it's covered so well, it doesn't really move very well, okay? So a lot of the things that you only need to know about the sternoclavicular joint is that it is the only joint that joins the shoulder girdle with the body proper. So without this joint, then your upper limb is not going to have a bony connection to the body proper at all. So now let us go over and talk about the acromioclavicular or AC joint. So this is your AC joint on the right side. And the AC joint or acromioclavicular joint consists of the lateral end of the clavicle articulating with the acromion process of the scapula right here. So now, just like the sternoclavicular joints, the components, the ligaments that helps reinforce the joint is going to be those capsular ligaments right here, as well as this ligament called the coracoclavicular ligament, which in itself is composed of 2 separate ligaments, the trapezoid ligament right here, as well as the conoid ligament right here. And when we talk about the bones of the upper limb, we have talked about this bone right here, okay? This is the clavicle, and on the underside, on the inferior side, if you will, of the clavicle, there are 2 structures, right? You have the conoid tubercle and the trapezoid line. The conoid tubercle is going to accommodate this end of the conoid ligament. And the conoid ligament is going to span from the coracoid process over to the conoid tubercle on the clavicle right here. And then after that, we have the trapezoid line, which will accommodate the trapezoid ligament, which also span for the coracoid process right here to the trapezoid line on the clavicle right here. Now, talking about shoulder muscles, a lot of these muscles are also going to be repeated when you learn about the trunk muscles, especially back muscles. However, these muscles are intimately involved in the shoulder, and because of that, we have to mention them here. And the most conspicuous muscle that you can see right away in this region is going to be this huge muscle that makes up a trapezoid right here, which is aptly named the trapezius muscle. And this trapezius muscle is going to be connecting the scapula right here. In fact, it connects the scapular spine over to the spine proper, okay, the vertebral column right here. So it connects the spine to the scapula, aka the scapula, over to the vertebral column right here. Okay, and the trapezius have three parts. Okay, the descending part right here, the transverse part right here, and the ascending part right here. And an important thing that you need to understand about the trapezius is that it is the only shoulder muscle as well as the only back muscle that is innervated by a cranial nerve. In fact, cranial nerve number 11, aka the accessory nerve, is the one that is going to innervate the trapezius muscle. So very important stuff. And then after that, we have another superficial muscle right here, which is going to be making up the bulge of your shoulder, which is the deltoid muscle. The deltoid muscle is named because it looks like a triangle. And in the Greek language, when you have a triangle like this is the symbol that is called by the Greeks the delta. And so because of that, because the deltoid muscle looks like this triangle, there's also another component in the front on the anterior side. You call this muscle the deltoid muscle because this is a triangle right here. The deltoid muscle is innervated by the axillary nerve, and it does three functions. It does flexion of the upper limb or of the shoulder joint, more like. It does abduction of the joint, as well as it does extension of that shoulder joint. Okay, depending on which part of the deltoid that we're talking about, the deltoid is going to do three of those actions. Okay, this is a very, very interesting muscle. Now, after that, we will go on to the deeper layers and explore the more deeper muscles down low. So now, after we have already removed the trapezius muscle on either side, you can see here, this is the muscles that we have that you will see immediately after you have removed the trapezius. There are two muscles that runs from the vertebral column all the way to your scapula. And those two are going to be, number one, the rhomboideus minor or the rhomboid minor muscle, as well as the rhomboideus major or the rhomboid major muscle. Those are the two muscles right here. And then after that, you also have the levator scapulae right here that runs from up here all the way to this angle here, the superior angle of the scapula. And when this muscle contracts, it helps you with shrugging your shoulder. It elevates this angle of the scapula. Okay, that is why it is called levator scapulae. Okay, and so these are some other illustrations that help you with visualizing these muscles. You can see that the trapezius muscle makes up a trapezoid right here. Over here, the trapezius has been cut off, revealing the nerve that innervates it right here, which is the accessory nerve, cranial nerve number 11. And then after that, you will see the deltoid making up the shoulder bulge over here, and the deltoid looks like a triangle. You can see that right here. There is an anterior part of the deltoid which helps with flexion. There is a lateral part of the deltoid which helps with abduction. And there is a posterior part of the deltoid that helps with extension of the shoulder joint. And the deltoid muscle is innervated by which nerve? The axillary nerve. Very good. That is why the axillary nerve runs through here. Okay, it runs very, very close to the underside of the deltoid muscle right here. And because of that, you can see why the deltoid muscle is innervated by this nerve, the axillary nerve. All right. So now you can also see the levator scapulae that goes through all the way over here in the transverse process of some of the cervical vertebrae all the way to the superior superior angle, okay, of the scapula right here, and it raises this angle or shrug your shoulders. Okay, that's why it's called levator scapulae. And here you have the rhomboid major muscle, and here rhomboid minor muscle. Let's move on. And for these shoulder muscles and these tables, as we have already talked to you guys in the previous lessons, and we will reinforce this in the other lessons down below. We will not go through every single thing here on these tables because it will take too much time. So instead of that, we should go over the things that will help you remember these things a little bit better at home, okay? And we have already gone through that in those previous slides. But just to reiterate one more time, the trapezius is that trapezoid-like muscle, okay, that goes from the spine, aka the vertebral column, okay, and all of these structures are going to be structures that lies under that midline in the vertebral column region, okay, and it will insert onto where? The spine of the scapula, the acromion, and the posterior border of the lateral 1/3 of the clavicle. Which nerve innervates it? Accessory nerve, cranial nerve number 11. So now, if you know the origin and if you know the insertion, can you guess the action of the muscle? And the answer is yes, you can. Because if you know where it comes from, where it is going to, so now you just need to ask yourself one question. Very, very simple question. What happens if that muscle gets shorter? Okay, so now, for example here, okay, trapezius muscle. You got this vertebral column in the middle, okay, and you have this trapezius muscle going from that vertebral column over to the spine of the scapula, right here, okay? So now, what happens if this muscle gets shorter? Then the scapula is going to be either elevated, okay, going nearer to the vertebral column on the back side, or is going to be depressed based on which part of the trapezius is doing the action, right? And that is why the action is elevation of the scapula, okay? Rotates the scapula during abduction of humerus above horizontal. Middle fibers will retract the scapula, okay? Retract the scapula. What does that mean? Making the scapula go more towards the midline on the posterior side. And the lower fibers will depress the scapula, just like we said. Okay, why? It is because we know where the muscle is originated. We know where it goes to, the insertion. So now you just need to ask yourself a question. What happens if it gets shorter? And you good. Okay, that's how you learn these things. It's not about memorizing facts. It's about memorizing some facts and then use those facts in order to find out the other facts. Okay, so that's something that I would like to relate to you. So now the deltoid, just like before, is going to be that triangular muscle, okay? And the origin of this deltoid muscle is going to be either the inferior edge of the crest of the spine, the scapula, aka the back part, the spine, the scapula, okay? The acromion process, which is the middle part of the deltoid, and then the anterior border of the lateral 1/3 of the clavicle, which is in the front. So now you have 3 parts of the deltoid. Each one does a different thing, right? And they all insert on one location, which we have learned before. The deltoid tuberosity of the humerus that is on the lateral side of the humerus. Okay, so now, what if this one gets shorter? Then you have, number one, if this part gets shorter, what happens? The shoulder joint is going to be extended, right? How about this one? What if this part that attaches to the acromion gets shorter? Is going to be abduction. Okay, and then what happens if this anterior part gets shorter? Flexion of the shoulder joint. Now let's see if we are correct. Abductor, okay, flexing, extending. See, that's how you learn these things. All right, so now levator scapulae, rhomboid minor, rhomboid major. I will let you do that on your own time at home. Good luck. Okay, next up. Sorry, guys. So next up, let's go over to the posterior scapular region. It is called the posterior scapular region very, very simply because of the fact that this region is located on the posterior side of the scapula right here. And there are only 4 muscles in this region. Number 1, this one up here, supraspinatus, okay? Then you have this one down here, okay? Infraspinatus. Okay, the reason why this is called supraspinatus and this is called infraspinatus is that one is above the spine and the other one is below the spine. Supra, infra. But what spine are we talking about? No, it's not this. It's not your vertebral column. Okay, it's not the spine that is in the middle. It is the spine of the scapula right here. The muscle that is on top of that spine, or more superior than the spine, is supraspinatus. The one that is more inferior than the scapular spine is infraspinatus. Simple enough? Okay. And then after that, you have this one here, okay, which is the teres minor muscle, okay, this one right here. A part of it has been obstructed by the infraspinatus, but it's there, okay, believe me. Teres minor is going to be expanding all the way from here, okay, from the medial inferior part of the medial border of the scapula all the way to the greater tubercle of the humerus right here. And then after that, another one right here, teres major, which extend also from the inferior part of the medial border of the scapula all the way to the medial lip of the intertubercular sulcus right here on the humerus. Okay. So now notice something very, very funny here. Teres minor inserts where? Greater tubercle, but where on the greater tubercle? The posterior part of the greater tubercle, right? So it's the posterior part of the humerus. So now, where does teres major insert to? To the anterior part of the humerus. Okay. So now, if I were to ask you on the exam, and you have a picture, right? Which muscle is this one? Can you guess what it is? Can you guess that is the teres major? Why? Because it inserts where? At the front of the humerus. Okay, this one is teres minor. Why? Because it inserts to the back of the humerus. Okay, this is a very, very important thing that you guys will need to know. Okay, especially on exams when you need to indicate what these components are. All right, so now there is also a muscle down here that you guys haven't learned yet, but we are going to cover just a little bit of it in order to cover these three spaces over here. And this muscle right here, the back or the posterior side of the arm, is called the triceps brachii muscle. And now the triceps brachii muscle, just like the name suggests, have three heads. Okay, this one is the long head. Now also over here you got the lateral head. And now the long head and the lateral head of the triceps brachii combines with the teres major over here and the teres minor over here in order to make three spaces. This is a space, this is another space, and this is another space. This space right here, in between the teres minor, the teres major, and the long head of the triceps brachii is called the triangular space. This space right here, in between the teres minor, teres major, as well as the lateral end, okay, the lateral side of the long head of the triceps brachii, as well as the medial side of either the lateral head of the triceps brachii or the humerus. That is the quadrangular space. And finally, in between the long head of the triceps brachii, the lateral head of the triceps brachii, as well as the teres minor, is another space right here, which is the triangular interval. So now these two can be very easily confused with each other. Triangular interval and triangular space. Notice that the triangular space is more superior as well as more medial than the triangular interval. Will help you with identifying which is which. And why are these spaces important? These spaces are important because neurovascular components, major nerves and major vessels travel through these spaces. Okay, and we will see which one later on. Now, one last thing that we are going to cover here, not in detail yet, okay, is going to be, you have the four muscles in the posterior scapular region, that is supraspinatus here, infraspinatus right here, teres minor right here, and then at the front or the anterior part of the scapula, which is not shown here, is another muscle. That is the subscapularis muscle. The supraspinatus, infraspinatus, teres minor, and subscapularis are going to combine in order to make something that is called the rotator cuff. And the rotator cuff is going to do two major things. Number one, it helps rotate the humerus or the shoulder joint, if you will. And secondly, it will help protect and reinforce the glenohumeral joint, as we have seen earlier when we learned about the glenohumeral joint. Okay, this is a very, very important couple of structures that you guys will need to know very, very well. So now another one of these tables, okay? Another one of these tables. I will let you go on and study them on your own time. Don't forget, okay? You don't need to memorize everything here. You just need to memorize, number one, the muscles that are major, okay? And then you need to memorize where it begins, where it ends. And then you can use those information to figure out what the function is. But the innervation here is absolutely important. Which nerve innervates which muscles? The more that you learn about this, the better. Okay, like for example, the supraspinatus and infraspinatus are both going to be innervated by the suprascapular nerve. Okay, the teres minor is going to be innervated by the axillary nerve, which muscle that we have already discussed also is going to be innervated by the axillary nerve. The deltoid, yes, the deltoid muscle is also going to be innervated by this axillary nerve. Okay, now the teres major is going to be innervated by the inferior subscapular nerve, and the triceps brachii, as we will see in the arm, is going to be innervated by the radial nerve. Okay, all right. So now we have already looked at these three spaces, okay, the triangular space, the quadrangular space, and the triangular interval. And now we will see what neurovascular components are going to go through them. Okay, for the quadrangular space, okay, two components are going to go through the quadrangular space. Number one, the axillary nerve, right here. Number two, the posterior circumflex humeral artery, right here. And how do you know that? Because after going through this quadrangular space, these two components are going to circle, okay, the surgical neck of the humerus like this. Okay, and if it circles the surgical neck of the humerus, they cannot be down here, because the surgical neck of the humerus cannot be down here, and it cannot be here either. Why? Because it will take way too long for it to circle the surgical neck if it goes through here. And so the axillary nerve, the posterior circumflex humeral artery, because they need to circle this surgical neck, they need to go through the quadrangular space, which is the space that is the nearest to the surgical neck itself. Okay, now how about the triangular space, which is right here? The triangular space is going to accommodate the passing through of the circumflex scapular artery. Why? Because it's the nearest one to the scapula, right? The circumflex scapular artery is going to be the one that go through this this triangular space and going to the back part of the scapula, where it will participate in what is known as the scapular anastomosis of arteries. Okay, and finally, going through the triangular interval down here, you have two components, one nerve and one artery. The artery is the deep brachial artery, or also called the profunda brachii artery, and the nerve is going to be the radial nerve. Okay, this is a very, very frequent exam question. So you need to understand as well as memorize these three holes, as well as what go through these holes. Very important. Okay, and now let us move on to the axilla. The axilla, or in colloquial term, is the armpit. This is the pathway into the upper limb. Many neurovascular components from the thoracic cavity over here can get through this space right here, which is the axillary fossa, or the axilla, in order to get into the upper limb right here. And the axilla is way more than just your axillary skin fold, which is right here. The axilla, in fact, is this irregularly shaped pyramidal space that looks like this. And it will have four sides: the medial wall, the lateral wall, the anterior wall, and the posterior wall. So medial wall, lateral wall, anterior wall, and a posterior wall that's posterior to this. And then it will also have an inlet that is up here and a floor that is right here. Okay, a floor that is right here. All right, so now let us go over these specific components and what is included in each of these sides of the pyramid. All right, so just like we said before, the axillary fossa or axillary region, if you will, it is an irregularly shaped pyramidal space that looks like this. It has an inlet right here, which is basically the lateral margin of rib 1, okay, as well as the clavicle and the superior margin of the scapular to coracoid process. Or you can see the inlet as the space that is in between the clavicle and the first rib, as we will see later on. And then you have the floor. The floor is simply just the skin of the armpit, which is basically this skin section right here that you have to scrub every time you take a shower. And it will open laterally into the arm, which is right here in this region right here and extending down. Okay. Now, the anterior wall, there will be muscles that will be encasing each of the anterior, posterior, lateral, and medial walls. For the anterior wall, you will have the pectoralis major and minor muscles, as well as the subclavius muscle that's sometimes back here, as well as the clavipectoral fascia. That is going to be the fascia that is going to be accommodating the pectoralis major and minor muscles. So those components are going to make up the anterior wall of the axillary fossa. For the posterior wall right here, you have the muscles that is anterior to the scapula. Like, for example, the subscapularis muscle. Remember the subscapularis muscle, along with the supraspinatus, infraspinatus, anterior minor, will make up what is known as the rotator cuff. And this is a very, very important structure, so you need to know it. Okay, so subscapularis, teres major, as well as the latissimus dorsi muscle and the long head of the triceps brachii muscle, those are going to be components that make up the posterior wall. For the medial wall, you have the upper thoracic wall, as well as a very important muscle, which is the serratus anterior muscle. Now, for the lateral wall, it is simply the intertubercular sulcus, and it is basically the easiest wall that you will learn in the axillary fossa. Now, the components of the axillary fossa are going to be the neurovascular components, like, for example, the subclavian artery and vein going into the axilla to become the axillary artery and vein going in here, okay? And then you have the lymphatics that runs from the arm all the way back up here, as well as the brachial plexus, which is basically a very, very important network of nerves that we will see later on in this lesson, which will also pass through this space in order to go down into the upper limb, into the arm, basically. All right, so now let's talk about the inlet. This is the inlet right here. And this inlet right here, the medial margin of it is the lateral border of rib 1. The anterior margin is the posterior clavicle, and the posterior margin is the superior border of the scapula. In other words, this inlet is in between the clavicle and the first rib, okay? And so sometimes it is called the costoclavicular recess, if you will, or that's what it's called in Vietnamese, okay? But you just need to learn that it is the axillary inlet, which is just back here, okay? So now, very important thing is that the subclavian artery, the artery that runs through here, becomes the axillary artery as it crosses the lateral margin of rib 1. In other words, it is enter the inlet, okay? So this is a pattern that you will see time and time again in the body, okay? An artery, when you go from one region of the body, like, for example, this region, over to the axilla, which is another region of the body, it will change names. Subclavian artery up here is going to become it's going to become the axillary artery down here. And the axillary vein down here, when it goes up here, it will become the subclavian vein. Okay, this is a very, very important concept that will be reinforced to you time and time again as you go through your medical journey. Now, the brachial plexus, which is also a very, very important network of nerves, is also going to be transmitted through from here through this axillary fossa. The floor is simply the skin of the armpit, as we have said before. This is one of the more easy boundaries of the axillary fossa, okay? And the skin of the armpit is going to open laterally into the brachial region right here. Okay, and now let's talk about the anterior, posterior, lateral, and medial borders. Okay, so now to orient yourself a little bit, in this image here, you got the ribs right here, which makes up the medial portion, okay, of the axillary fossa. So it's the medial border right here. Okay, you have the muscles here on the anterior part of the axillary fossa, which is going to be the pectoralis major and minor muscle. This is pectoralis major. This is the pectoralis minor. And you will also have the clavipectoral fascia that's going to also make up a portion of the anterior border as well. Then you have the posterior border, and there are a lot of muscles in the posterior border, including the subscapularis muscle right here, the teres major muscle, the latissimus dorsi muscle, as well as some other muscles that we will learn later on. And then the lateral border of the axillary fossa is very simply just the intertubercular sulcus. Remember, the intertubercular sulcus is that groove that runs in between the greater tubercle and the lesser tubercle of the humerus. All right, so now let's talk about anterior wall. Anterior wall is going to consist of the pectoralis major muscle right here, okay? The pectoralis minor muscle, which is going to be a little bit deeper to this, as well as the subclavius muscle, the very, very tiny muscle that sometimes is absent up here, so inferior to the clavicle, you will, subclavius, inferior to the clavicle, as well as the fascia called the clavipectoral fascia. So now, let's talk about these components in relationship to each other. So now, you can see here that the pectoralis major is the most superficial component of this anterior wall. If you remove this pectoralis major muscle, you will end up with the pectoralis minor down here, okay? And then you will have the subclavius muscle over here, as well as the fascia right here that covers the pectoralis minor muscle, the subclavius muscle, okay, as well as the majority of this part, okay? And that also makes up a portion of the anterior wall, which is this wall right here. See that? Okay, of the axillary fossa. So this is the clavipectoral fascia. So the clavipectoral fascia, what does it invest? The pectoralis minor muscle and the subclavius muscle, as well as some other components inside here. Okay, the pectoralis major muscle isn't invested by the clavipectoral fascia, but instead it's invested by another fascia altogether, which is the pectoral fascia. Okay. And now you can see in this image, very, very beautifully illustrated, the cephalic vein, a superficial vein on the upper limb, is going to go through the clavipectoral fascia in order to get into the axillary vein as it travels up to become the subclavian vein. All right, so now for the anterior wall, we have these muscles over here, pectoralis major, subclavius, and pectoralis minor. Once again, I will not say everything inside of this, but I will emphasize on the innervation, the nerves that innervates these muscles, as well as the things in these muscles that I think you should know in order to make the learning of these muscles a little bit easier for you. For example, pectoralis major is a very big muscle, so people divide it into three parts. There is a clavicular head, there is a sternal head, and there is an abdominal portion of the pectoralis major. So what does that mean? Here, you can see that there is a clavicular head right here, this portion here of the pectoralis major. Let me just illustrate it using a pen. Here it is. This is the clavicular head of the pectoralis major. You can see that another part of the pectoralis major will be connecting to the sternum, and therefore this is the sternocostal part of the pectoralis major right here. And then one more thing is going to connect to the abdominal muscles, the rectus abdominis, and everything down here. And therefore, this is the abdominal part of the pectoralis major. There are 3 parts of the pectoralis major, and they all is going to connect back to this portion here of the humerus. So now let's just go over it 1 second. The lateral lip of the intertubercular sulcus of the humerus, and that's the insertion. Okay, so now with this image in mind, this is the origin. These are the origin, 3 origins, right? This is the insertion. The insertion is the one that moves right here. So now what would happen if this one gets shorter? What would happen? The insertion is going to be pulled into here, as well as because the pectoralis major is in front or anterior, this humerus is also going to be pulled forward, right? So what are the 2 major action of the pectoralis major? Is going to be the flexion of the shoulder joint, as well as the adduction, okay, as well as internal rotation of the humerus, right? Let's see if I'm correct here. Flexion, adduction, and medial rotational arm at glenohumeral joint. See that? See that? That's it, okay? So now, pectoralis major is a huge muscle once again, and therefore it is innervated by 2 major nerves, okay? It is going to be innervated by both the medial and the lateral pectoral nerves, okay? Now, in contrast with that, the pectoralis minor muscle, okay, is a way smaller muscle that's going to be only innervated by 1 nerve, which is the medial pectoral nerve, okay? And the thing with pectoralis minor is that it is originated from these ribs right here. Well, okay, so these ribs are 3, 4, and 5. Ribs 3, 4, and 5, and they're all connected back to the coracoid process right here. Okay, so that's the insertion. The coracoid process is the insertion up here. Okay, so now this muscle is kind of weird in that when you contract it, okay, the insertion moves over here, but also if you keep the insertion, which is the coracoid process, fixed, then these three parts here of the pectoralis minor is going to elevate ribs 3, 4, and 5. So what will that help with? That will help with increasing the volume of your rib cage, and therefore helps you with respirational effort, okay? So when you inspire in your inspiratory phase of the respiration, you would have to increase the volume of your thoracic cage. And one of the ways that you do that is by elevate rib 3, 4, and 5 using the pectoralis minor. So it will help you with respiration. However, in normal respiration, it does not play a big role. It only plays a big role in more forced inhalation type of thing. Okay? So pectoralis minor, it can pull the coracoid process down, it can protract scapula, but something here that it doesn't say to you is that it's also an accessory respiratory muscle. Okay, it's also an accessory respiratory muscle, as you will see when you go about onto the physiology of breathing, okay, later on in year 2. And then the subclavius is just this tiny, tiny piece of muscle that is over here. Okay, and the subclavius muscle is innervated by a nerve that is aptly named the nerve to subclavius, which also arises from the brachial plexus. All right, so now let's go on to posterior wall. Posterior wall is the most complex wall in this whole axillary fossa, okay, because it makes up by multiple muscles. And those multiple muscles are going to be the subscapularis muscle here. Remember, the subscapularis muscles together with the supraspinatus, the infraspinatus, and the teres minor makes up the rotator cuff. Okay, I'm just going to keep on repeating that because you need it. Okay, you need to know that what muscles are going to be the rotator cuff muscles, because the rotator cuff is one of the most important anatomic landmark and structure within the human body. Okay, so the 6 muscles, remember that: supraspinatus, infraspinatus, teres minor, subscapularis. That is going to be your rotator cuff muscles. Okay, very important. You need to remember. Now, not only would contributes to creating the rotator cuff, the subscapularis is also going to contribute alongside with the teres major muscle right here, the longissimus dorsi muscle right here, okay? Longissimus dorsi muscle right here, as well as a part of the long head of the triceps brachii over here, in order to make up this posterior wall, okay, of the axillary fossa, okay? And there's also a bone that helps support the subscapularis, and also is mentioned here, that is of course, the scapula. Okay, so the posterior wall is going to consist of multiple structures: the scapula, the subscapularis, the teres major, the latissimus dorsi, as well as the long head of the triceps brachii muscle. So now, the subscapularis muscle, okay, is this muscle that is located within the subscapular fossa of the scapula. Okay, so it is innervated by the upper and lower subscapular nerves, and the origin and insertion and function I'm going to let you study on your own. Okay, teres major muscle, just simply like that, is going to be innervated by the lower subscapular nerve. The latissimus dorsi is going to be the thoracodorsal nerve, which is also a terminal branch of the brachial plexus. And then the long head of the triceps brachii is going to be innervated by the radial nerve. So now, one of the things that we will learn about when we learn about the arm is that everything that is posterior to the arm is going to be innervated by the radial nerve. Okay, very, very important stuff. All right, so now let's go on to the medial wall. The medial wall is going to be made up mostly of the ribs, the intercostal spaces between the ribs, as well as this muscle right here that is called the serratus anterior muscle. Okay, now serratus anterior, okay, serratus anterior, the way that you call it the serratus anterior, the reason why is because it looks like a saw, okay, serrated, a saw-like muscle, okay. Serratus anterior is this muscle right here, okay, and the nerve that innervates the whole muscle is the long thoracic nerve that kind of runs like this. Okay, this is a very important stuff that I'm telling you now. It's very important. You need to understand this. Okay, serratus anterior muscle is this muscle right here. Okay, and the long thoracic nerve is the nerve that controls that muscle. Okay, so now the ribs right here, okay, as well as the intercostal space, the spaces in between the ribs, if you will, okay, the upper 3 or 4 of them, to be in fact, okay, as well as the long thoracic nerve, the serratus anterior, the upper part of it, as well as the intercostal brachial nerve, is going to help make up the medial wall of the axillary fossa. Okay, the intercostal brachial nerve makes up very little. It's simply just a nerve that pierces the medial wall, basically. So now, serratus anterior is a very important muscle. As we said, it is innervated by the long thoracic nerve. But now, let's see its function. The function of the serratus anterior is the protraction and the rotation of the scapula. But this is not as important to the second function here. This muscle also keeps the medial border and the inferior angle of the scapula opposed to the thoracic wall. Now, what does this mean? What does this mean? Well, if you look at this muscle, it goes from these ribs over here, and it inserts all the way at this border. What is that border? That will be the medial border of the scapula. So now, if you have a muscle that pulls on the medial border, what it does, it will, when it contracts, okay, and it contracts tonally, it will make the medial border of the scapula very, very close. It will pull this border very close to the posterior part of the rib cage, so that this border does not come flying out. Okay, this one is a very important function of the serratus anterior muscle, and if you have a dysfunction in the function of the serratus anterior, as in the case when you get rid of the function of this nerve, this will happen. See that? And compare it with this side. This side, the medial border of the scapula is right here. But can you see it? You can't, right? Because this medial border, through the action of the serratus anterior, is going to be pulled very, very closely into the posterior part of the ribcage. But now what happens here? The scapula, the medial border of the scapula is being blown apart, okay? Blown apart from the posterior part of the ribcage right here. What happens on this side, which is the left side of the patient? Now, this patient long thoracic nerve on the left side may have been damaged. And when it is damaged, the serratus anterior does not get its nerve supply and it stops functioning. Therefore, the medial part of the scapula, as well as the inferior angle of the scapula, is going to be flying away from the posterior part of the ribcage. And therefore, we call that winging of the scapula or scapular winging. Okay, and this is a clinical correlate that gets asked all the time. So you need to remember that. You need to understand why this happens. All right, so the lateral wall, very simply, consists of the intertubercular sulcus. And that's it. So now let's talk a little bit about the axillary folds. So what the axillary folds are going to be these two folds, the anterior fold right here and the posterior fold right here. Okay, that makes up the border, anterior and posterior border of the skin of your axillary region right here. Okay, and there are muscles that makes up these folds. Okay, the anterior axillary folds is going to be made up by the pectoralis major muscle right here. You see that? This border helps make up the anterior axillary fold. Now, the posterior axillary fold is actually made up of two muscles, the latissimus dorsi, which is the huge one, as well as the teres major, which is the little one that contributes up here. Okay, that makes up the posterior axillary fold. Now, as a little bit of a, a more extra information for you guys that I throw in for free, okay? Besides from these axillary folds, people tend to talk about axillary lines, okay? Axillary lines. Axillary lines. So what are these things? There are three of them actually: anterior, middle, and posterior axillary lines. The anterior axillary lines is just simply that line that extends from the anterior axillary fold downward like that. Okay. The posterior axillary line is the posterior axillary fold, but you extend it downwards like this. And finally, the middle axillary line, okay, the mid-axillary line, if you will, is the line that right in the middle of those two lines right here. So the anterior line is right here, the posterior line, that's right here, and the middle line, that's right here. You will need to know that because clinical textbooks are going to tell you, oh, you need to put the ultrasound probe at the mid-axillary line, and you will not know what that is unless you study this, okay? Very, very important piece of information, and you are lucky that I throw it in for free. All right, cool. All right, so this is another one that shows you the posterior axillary fold right here. Okay, the posterior axillary fold is this one. That is going to be made up by the teres major muscle, which is this muscle here. That is going to contribute a little bit to it, as well as the latissimus dorsi, which is this huge muscle here. Okay, that contributes much to the length of the posterior axillary fold on the inferior side. All right, let's look at the contents inside the axilla. So inside the axillary fossa, there are a couple of components that you need to know. Most importantly, you will need to know about the axillary vessels, aka the axillary artery and the axillary vein. You also know the axillary lymph nodes, which are pretty important, especially in terms of cancer metastasis. Especially when we're talking about breast cancer metastasis, the axillary lymph nodes play a major role, especially when we're talking about the lateral and superior lateral portion of the breast. Then We shall also talk about the brachial plexus, which is a network of nerves that runs through the axilla in order to get into the upper limb. And this brachial plexus is basically this bundle of nerves that is going to innervate all of the skin and muscles of the upper limb. So of course, this one is going to be a very, very important component of what we will be talking about. So now let's talk about the first component that you need to know, which is the axillary vessels. Let us commence with the axillary artery. Now the axillary artery is the subclavian artery that has renamed after it enters the axillary fossa. So here you can see that this is an artery, which is called the subclavian artery. The origin of the subclavian artery will be provided to you when you study the face and the head, neck, when you study the head and neck, excuse me. Okay, so the subclavian artery is going to come out from brachiocephalic artery on the right side, and from the aortic arch directly on the left side. It is going to course upward, superiorly like this, and then curves down inferiorly, and then it's going to pass the point between the clavicle and the first rib, which, if you remember, is the inlet of the axillary fossa. And when it passed into the axillary fossa, it is going to be renamed into the axillary artery. Now, the axillary artery is going to be divided into 3 parts, and these 3 parts are going to be divided based on their relationship with the pectoralis minor muscle right here. So now, if you are talking about the portion of the axillary artery that is right here, it is the portion that is proximal to the pectoralis minor. That's the first part of the axillary artery. The second part of the axillary artery is going to be right posterior or behind the pectoralis minor right here. This is going to be the second part. And then the third part is going to be this part right here that is going to be distal to the pectoralis minor in reverse onto the first part. Okay, so the first part is proximal to the pectoralis minor. The second part is behind or posterior to the pectoralis minor. And then the last part, the third part, is going to be distal to the pectoralis minor. From each part, there will be a couple of side branches that you need to know. There are 6 total side branches of the axillary artery. And those 6 side branches are going to be, number 1, the superior thoracic artery. Number 2, the thoracoacromial artery. Number 3 is going to be the lateral thoracic artery, which is right here. Number 4 is going to be the subscapular artery, which will eventually give rise to the circumflex scapular artery, as we have talked about before when we talk about the triangular space. Then we'll also have the anterior and the posterior circumflex scapular artery, which are also side branches of the axillary artery. The terminal branch of the axillary artery, when you go down here, is going to be the brachial artery, which is going to be the continuation of the axillary artery as it passes through the inferior border of the axilla and into the arm. And right here, there is a table that will not only tell you what are the side branches of the axillary artery, but also tells you where they arrive from. Is this the first part, second part, or third part of the axillary artery? I don't require you to remember everything here, but you need to remember at least, if there's a diagram right here, where each of the side branch is, okay, and where approximately do they go to. All right, so now after we talk about the axillary artery, we shall also have to talk about something that's going on at the posterior scapular region. Okay, the posterior scapular region, the region where there are muscles such as the supraspinatus up here, the infraspinatus, the teres minor and teres major muscle, they are going to be they are going to be supplied by oxygenated blood from 3 major vessels. One of them is right here, the other one is right here, and the other one, the last one, is right here. Together, these guys form anastomoses, which are connections between these arteries together to make up what is known as the scapular anastomosis of arteries. Okay, and those three vessels that makes up the scapular anastomosis are going to be, number one, the circumflex scapular artery, as we have seen before, which is a side branch of the axillary artery, which goes through the triangular space right here to pass onto the posterior side and form this part of the anastomosis. Then you will have two branches that arise from the subclavian artery. The suprascapular artery right here, which is going to go over here and anastomose with the circumflex scapula right here, as well as the dorsal scapular artery, which is another side branch from the subclavian artery, which goes down here like this and anastomose with the other two. Okay, and eventually those going to form the scapular anastomosis of arteries, as you have seen right here, which is the connection of these three branches. So that's suprascapular artery. That is the posterior circumflex humeral artery. That is the dorsal scapular artery. And finally, this is the circumflex scapular artery. And the actual scapular anastomosis is going to be between these three guys. Okay, so a little bit of a tidbit, the dorsal scapular artery and the suprascapular artery right here and right here, they are branches of the subclavian artery. Remember, the subclavian artery is the artery before it becomes the axillary artery as it passes through the axillary fossa. Okay, so that's quite important. Okay, now we'll talk about the axillary vein. And the axillary vein is what is known as a continuation of the basilic vein. Basilic vein is the superficial vein of the upper limb that is located on the medial side of the upper limb. And so the basilic vein is going to come down from here, pierces the superficial fascia over here, okay, as well as the deep fascia, and go down and go into the axillary fossa, where it becomes the axillary vein over here. Okay, so the basilic vein starts out superficially, pierces the fascia to go deep, and becomes the axillary vein over here. And parallel to the basilic vein, you also have the cephalic vein over here, okay, which is another superficial vein of the upper limb. The cephalic vein is going to run within a groove that is also called the deltopectoral groove. Okay, that is formed in between the deltoid muscle and the pectoralis major muscle, which is this groove right here. And the cephalic vein is going to continue within that groove over to this side here, where it pierces the clavipectoral fascia, as we have seen before, and go into the axillary fossa, joined with the axillary vein in order to become the subclavian vein as it travels through the inlet of the axillary fossa into the thoracic cage. Okay, so the axillary vein is right here, right before it becomes a subclavian vein right here. So the tributaries of the axillary vein is going to be those branches that following those of the axillary artery, as well as the brachial veins. Okay, and the brachial veins are going to be these guys right here that are going to be paired, okay, and follow with the brachial artery. And we shall learn about them more specifically when we talk about the arm, which is going to be the upcoming lesson. Okay, so now let's talk about brachial plexus. The brachial plexus are going to be this important bundle of nerves that is going to pass through the axillary fossa and gives innervation to both the skin, which is cutaneous innervation, as well as the muscles of the upper limb. So this brachial plexus is pretty important. Now, the brachial plexus is going to be formed by the anterior rami of the spinal nerves from C5 to T1, which is basically from here to here, okay? And those anterior rami are going to form what are known as these tree trunks, okay? 1, 2, and 3 trunks. Those tree trunks are going to be divided into 6 divisions, 3 anterior divisions and 3 posterior divisions. Now, the way that the divisions works is going to be, if you have the anterior division is going to be innervating the anterior compartments of the upper limb, like for example, the anterior arm, the anterior forearm, as well as the majority of the hand. The posterior divisions are going to be innervating mostly the posterior compartments of the upper limb, which are going to be the posterior arm, as well as the posterior forearm, as we will see in subsequent lessons. And then from the divisions, you are going to have, they will join together again to make cords, which are the 3 cords, the medial, lateral, and posterior cords, that is right here. Okay. The way that these cords are named, medial, lateral, and posterior, is simply because of the fact that they surround the axillary artery in that order. One is going to be medial to the axillary artery. The other one is going to be lateral to the axillary artery. And the last one, you guessed it, is going to be posterior to the axillary artery right here. Okay. And from these 3 cords, 5 terminal branches are going to be getting their origin from the 3 cords. And those 5 terminal branches are going to be the musculocutaneous nerve, the radial nerve, the median nerve, the ulnar nerve, as well as the radial nerve. Okay, so once again, it's going to be the musculocutaneous nerve, the median nerve, the ulnar nerve, the radial nerve, and the axillary nerve. I think I missed axillary nerve the first time. Okay, so those are the 5 terminal branches. All right, so now this is another diagram of the axillary, the brachial plexus in detail. You can see that the plexus is going to be made up of the anterior rami from C1 from C5 to T1, and as they come together, okay, to make these trunks, and the trunks is going to divide to make 6 divisions. 6 divisions are going to join together once again to make 3 cords. And the positioning of these 3 cords are located around the axillary artery, as you can see here. There's going to be a lateral cord, which is lateral to the axillary artery, medial cord, which is medial to the axillary artery, and the posterior cord right here, which is posterior to the axillary artery, as you can see. And those 3 cords are going to give rise to 5 terminal branches: musculocutaneous, the median nerve, the ulnar nerve, the axillary nerve, and finally, the radial nerve. Here is a schematic of everything that we have talked about so far. Okay, you have roots, which are the anterior rami from C5 to T1. You have the 3 trunks. You have the 6 divisions. You have the 3 cords, which are arranged around the second part of the axillary artery. And then you have the terminal branches, which are these 5 right here. And this is a more detailed diagram that shows you not only the terminal branches, which are the musculocutaneous, median, radial, ulnar, and axillary, but also the side branches. And these side branches are actually more advanced, and we will cover it in more advanced classes later on, or your clinical classes. Okay, but the focus that we are going the things that we are going to be focusing on, okay, in this class is mostly those 5 terminal branches. Okay, these 5 right here. Your job during the next couple of classes of the upper limb is to figure out what do these nerves of the 5 terminal branches innervate. What skin region do they innervate? And what muscles do they innervate? Okay, this alone is a very daunting task, and you can only do this after a lot of study, okay, and revision of the material. So I expect every single one of you guys to go ahead and review the material so that you know all about these terminal branches. Okay. All right. So from this slide onwards, they are going to be listing all of the terminal branches as well as the side branches and their function. So now what you should be focusing your efforts in are going to be these slides right here: the musculocutaneous, the axillary, the median, the ulnar, and the radial. I'm not going to go through every single one of these slides right now because it is going to be too much for your brain to handle, as well as we will cover a whole lot of this during subsequent lessons anyway. So what I would like you to do is go back home, review this chart, but don't learn by heart everything in here right away, okay? Because we are going to get back to all of these branches when we talk about each component of the upper limb, like for example, the arm, the forearm, okay, as well as the hand anyway during subsequent lessons. Okay, finally, let's talk about the axillary lymph nodes. The axillary lymph nodes are about 20 to 30 axillary lymph nodes that lies in, you guessed it, the axillary region or the axillary fossa. And they are divided into 5 groups. And those 5 groups are going to be, here is the apical nodes, okay, right here. And then you have the central nodes, which is located right here, okay. And then after that, you have the lateral nodes and the anterior or the pectoral nodes, which are located somewhat right here, okay. The lateral nodes are going to be the humeral nodes that are right here, okay. And then you have the posterior nodes that are not shown on this diagram, which is also called the subscapular nodes because they are located right inferior to the scapula, if you will, okay. And those 5 groups, okay, there is so those 5 groups is going to receive limbs, okay, from the superior part of mammary gland, as well as the anterior lateral body wall and central lateral body of mammary gland. So this is a very important thing for you to remember, is that the mammary gland, especially the superior and the lateral part of the mammary gland, the lymph nodes that receive most of the lymph coming from those portions are going to be the lymph nodes in the axillary region. And therefore, if there is a metastasis of, for example, breast cancer in these parts of the mammary gland, guess where it's going to end up? Right here on these nodes, okay? So that's why these nodes are clinically important, and that's why you need to learn them, okay? So besides from the mammary gland, these nodes are also taking lymph from some of the upper limb right here, as well as most of the upper limb right here, okay? So basically, all of the upper limb is going to have their lymph drain into these nodes as well, okay? So these nodes are clinically important, and you need to know them. And after they've gone into the axillary lymph nodes, okay, the lymph vessel is going to come from these nodes back into the circulation via the right subclavian trunk, and finally the right lymphatic duct that is located right here. And then the right lymphatic duct is going to empty all of those lymph into this junction between the right internal jugular vein as well as the right subclavian vein right here. That is what the right lymph drainage is going to be. And if you're talking about the left lymph drainage, it's another story altogether, but we will learn that later on. All right, that is it for this lesson, you guys. Thank you very much for your attention. If you have any question, then please reach me during next class, or email or Zalo message me. And my name is Kwa. Thank you very much for your attention, and I will see you guys in class. Bye-bye.